Thank you so much today for joining this webinar. It's actually the third webinar of a series of webinars for the program CLL Care, Comprehensive Advance in Patient Care. And this one in particular, we are very proud of because it's focused on the CLL patient's experience. So we have the pleasure of having Catherine Huntley today here, General Manager Health Services from Leukemia Foundation, Australia. And Catherine will present the results of VOICE, the worldwide survey that we organize and publish in Blood Advances, and also her experience with the Leukemia Foundation. So thank you so much, Catherine, for being here, and the floor is all yours. For the housekeeping, yes, just for the participants to know that they are muted because this is a webinar series, but we encourage you a lot to use the chat box and also the Q&A box, so you can use it through all of the webinar, and we will take your question at the end of the speech. Thank you so much.
Thank you, Sarah, for the introduction. It's my honour to come along today and share the results of the VOICE survey and publications that have occurred over the last couple of years, which was an international collaboration for many different patient groups that distributed the survey out. But I'll go into that a little bit more later on. Tonight's objective, because it's tonight where I'm coming from in Australia, but no doubt different time zones right from where you are joining us today. But today's objectives is to understand the patient perspectives on CLL and the management of CLL for them, to assess the real life factors that can improve patient outcomes and well-beings, to explore and understand a little bit more about the experiences that I have had with leading the support services for blood cancer patients in Australia, and how the associations like the Leukemia Foundation on a global scale are supporting CLL patients worldwide. And the final part of today, we'll be sharing and learning around the VOICE educational platform, which will be designed for CLL associations to help address the educational gaps for CLL patients. So for a little bit of context settings of what blood cancer and CLL in Australia looks like, we know in Australia that around 20,000 people will be diagnosed with a blood cancer, and lymphoma remains in Australia as one of the most common types of blood cancer. CLL, however, accounts for 12% of all blood cancer diagnoses, which is approximately 2,000 persons per year in Australia. Treatment changes we first have seen over time, and within the introductions of immunotherapies, have seen our blood cancer treatments become the most expensive cancers to treat across the spectrum of cancer diagnoses, with myeloma and leukemia two of the top three most expensive out-of-pocket costing treatment for everyday Australians who will be diagnosed with these diseases. We've seen, I guess, in the last 10 years, dramatic changes primarily in that CLL area with how treatment has changed, and the changing over time that we are seeing with people being less treated as an inpatient and more treated as an outpatient with recovery in the community. We're also seeing, coupled with that, changes on human behaviours and how people interact with the world. 15 years ago, we didn't have the access to the internets in our hands, and we're seeing how this is a reality for our patients, and how best do we support people in this world of digital demand. And importantly, over time, one of the theories that we have seen as well is that cure or being a survivor isn't necessarily how people with a diagnosis of CLL identify, because they aren't cured, and it's a long-term chronic condition. And we are also aware that for people with CLL, that first initial diagnosis period can look really different from immediately starting some type of therapy or placed in a watch and wait cycle. And as we know, majority of people will tell and report back to you that they much rather call this a watch and worry cycle more than anything else. I guess adding to the complexities of Australia, for those who aren't from Australia or no Australia? Well, 28% of our general population live outside of metropolitan areas in regional and remote communities, meaning their access to specialised care needs to occur in our capital cities in Australia, which can look like relocation for them and time away from home to access that therapy, and making sure that, I guess, with the geography of Australia, it can be quite long travels to this treatment. It's not uncommon for people in regional areas to travel 4 hours to see any kind of specialist, let alone the complexity of a hematologist. So that provides the challenges for us in Australia to how do we provide that continuum of supportive care across that whole disease journey experience from diagnosis right through treatment, the cycles of being on treatment, off treatment, and unfortunately for some people, the progression to end of life care. So one of the initiatives that we are working towards in Australia is setting the standard of care for people. The Leukemia Foundation, as Secretariat, with federal government funding, led a blood cancer task force. And one of the outputs of the blood cancer task force was establishing these optimal care pathways for people diagnosed with the various types of blood cancer. Here on the screen is the example of the optimal care pathway for those people diagnosed with CLL. And this is a guide to support healthcare professionals right through the diagnosis, prevention, early detection, through staging, treatment, care after initial treatment, managing relapse, as well as end of life care. And importantly, it goes through those clinical aspects, but other moments like referrals to patient organisations, allied health services, that holistic model of care, and really setting a standard of what best practice looks like in managing a patient diagnosed with CLL. We have also released, as a part of the task force, a collaborative effort of a blood cancer community, a pathway for patients themselves to utilise to support their conversations with their treating specialist, or right at the beginning with their general practitioner, to support that earlier detection of potential CLL diagnosis. Across all optimal care plans, and these are actually developed across all our, are working towards having these developed across all cancer diagnoses in Australia. There are underpinning principles which ensure that the holistic and best practice moments of both the cancer care for a patient and access to things like research and understanding of research and clinical trials are there for people. My area of experience and what the voice survey spoke to is around the underpinning principle, I should say, around supportive care. And when I refer to supportive care in this sense, it isn't the clinical sense of supportive care where someone may have transfusion support as a part of improving their quality of life, but what other factors within a person's life that isn't a part of their blood, the blood part of their disease, or this, can we look in that holistic model of supportive care and what can be provided to people to improve those quality of life, well-being outcomes, and importantly, the navigation of their treatment journey. So what we understand in Australia, and there's been a lot of research, psycho-oncology research, as well as at the Leukemia Foundation, we led a State of Nation around understanding what is the unmet need and domains of supportive care that people are currently having challenges with. The information at the top around supportive care unmet need was a part of research led by NINCA, which was post the COVID, well, through the actual COVID pandemic in 2021, and understanding what are those levels of distress that people were indicating. 35% of people reported clinical levels of distress, 32% of people reported at least one unmet need in the supportive care area. And it may not come surprise to majority of people on this webinar and those who will listen afterwards that 95% of those in remission had a clinical fear of reoccurrence. The domains of supportive care in our state of the nation indicated very high levels of people facing challenges over those domains of supportive care that impact on a person's everyday quality of life. So while we're treating their blood cancers and their CLL, we're not necessarily having the impacts that we'd like to see in those domains and people living those high quality of life beyond their diagnosis, with 70% of people reporting physical challenges, 71 in the emotional domain, 54 in those social challenges, and 45% in practical challenges. Later on, I will be sharing also within the voice survey areas that have also been identified similar to this. I guess it's important to remember when we look at population of people with blood cancers and people with CLL in particular, that what works for one person isn't necessarily going to work for another. And importantly, that one diagnosis does not equal a one size fits all solution. And importantly, for a person, their social determinants, as well as their diagnosis and risk and treatment and response to treatment, will impact their life outside of their diagnosis very differently. These are real people, and as you can see, have shared age group, but very different journeys, for want of a better word, as a part of their CLL. Person A had failed multiple lines of therapy, both traditional FCR when they were diagnosed, as well as some more of the immunotherapies. But because of this person's high level of literacy, self-funded wealth, they were able to access a clinical trial and advocate for themselves to get there. The person represented by B, also in their mid-40s, was diagnosed and commenced therapy as soon as they were diagnosed. Again, they were an FCR timing of therapy as being best in class at that time. With their second round of treatment, they actually ended up with an ICU admission. This person didn't have the health literacy of the person of number A, didn't have the financial resources, was really concerned about that this was their life now, and this was going to be a very complicated moment, and led to a mental health risk moment, questioning their value of life for their family if this is how they could contribute to them. And the person in number C, again, mid 40s, remains treatment naive, nil symptoms, nil social determinants have changed. And for them, CLL is the occasional conversation that they have with their specialist, and remain to this day treatment naive. So as you can see, as a service planning point of view and understanding what the unmet need may be for these people, and how do we meet that at a service level, becomes quite a challenge when we look at these people. In Australia, sorry, I need to go backwards. In Australia, our Cancer Australia and COSA, which is our Clinical Oncology Society Australia, use Margaret Fitch's need stratification as a best practice approach to supportive care. And this is something that at the Leukemia Foundation we have also incorporated in our service planning. And it looks at the cancer as the cancer population as a whole, and that different people, depending on their needs and what elements of their life are actually met. So for example, someone, well, all people should receive a relevant provision of information, of understanding of their disease. For approximately 20% of the population, this will be enough for them as a need requirement. They will have their needs met and will continue on without any further information requirement at that time. But for other people, they will need further support or additional information. And for a few people right down at the bottom, 10 to 15, they will need a really strong, facilitated, complex interventions to help support their information needs. So it's a spectrum of need framework over the course of a population. So this need stratification has been around for an extended period of time. And today we know that people are living longer with the consequences of their diagnosis and the treatments, and that we know that accessible supportive care to address the challenges of recovery because of this is increasingly required. As I mentioned earlier, we know that our modern world is changing and we're living in a much more connected world, and people are demonstrating information seeking behaviours outside of their medical system. So how do we ensure that people are getting the right information that is high quality, high clinically regulated information that's going to be relevant to them as they navigate their journey? And what many research pieces have shown, and what we've also seen in Australia, that there is a high burden of unaddressed need across all our supportive care domains for many of the patient groups and at all stages of their experience. Margaret Fitch talks about key areas along a cancer diagnosis continuum where people are at a higher need or higher risk of unmet need in areas such as diagnosis, the commencement of treatment, the transition into beyond treatment and relapse and end of life. So in a world of how do we support people is targeting those moments where we know that that need requirement for people is going to be higher. So I guess what I've shared to date up in with these slides is the current state of the CLL and blood cancer unmet need, the frameworks that exist in best practice and solutions through OCP at a system level of how we can start establishing a standard of practice for people to work towards. In a service model space, how do we meet those supportive care? Well, first and foremost, it needs to be person-centered and an integrated care model. And I guess what I have learned over time is that person-centered to the moment of talking about person ABC diagnosed with the different elements of their CLL with their different histories behind them. Being person-centered means addressing those equity issues, the complexities behind an individual and those diversity of individuals, and offering a service that isn't one size fits all, and tailoring your service to ensure different levels of need. So what that can look like is, for example, the Leukemia Foundation, we have a patient information booklet. We've also developed booklets for our First Nations people, our content online, and our booklets are targeted at a certain level of literacy to have broad ranging understanding. They also have accessibility options for those who are vision impaired. And we also have developed a digital tool and offer support programs and access to team members, people who want to discuss that more complex understanding of their diagnosis or treatment. For me, one of the things that I've learned is a success of a service is really enabled by partnering with the end user that the service is about. And this is more than a tick and flick moment that you've consulted with a consumer. Think about co-design, think about really sitting with people. And I've had these moments, especially in the CLL space, of just hearing the story. Tell me a story. What is it like? What did that mean for you? And gathering those qualitative, rich moments and going through them afterwards, across the spectrum of interviews to really call out those key themes. And sometimes what seems like a big problem statement to solve can be really targeted down with some key themes of unmet need sort of across the board, despite the complexity of individuals behind that moment. Supportive care, importantly, means considering the whole person impacts. So the CLL beyond the clinical. And importantly as well is it's not just about the disease. Contemplating and incorporating into the interventions of how the support that can be provided and the services that can be provided can improve a person's self-efficacy and navigation of all the overall impacts of CLL. So when we look at providing an online content service, for example, or online support, we know that there's a digital divide, and whether that be because of slower internet, because of where a person resides or their age, how do we actually support people with digital literacy? Because what we do know is that more and more of our society, and the WHO is talking very importantly around digital literacy, is society's is translating more and more online. So supporting a person to navigate a digital world is also going to enable them to navigate their financial banking world or the navigation of social or welfare applications, because those things are also online. So it's the tools for navigating CLL, but it's also how those tools help them navigate the broader aspects of CLL and their life. One of the other important lessons learnt for me is offering a multi-channel service that supports the personal preference of engagement, but it also goes back to that Fitch's model of a tiered level of service can actually address that complexity of need. And importantly as well, being person-centered, when we look at the diagram of the light, is that, you know, making an assessment of a person from the get-go isn't going to have the longevity over time. When we think about a person may have a savings buffer for them financially when we first interact with them, but this is eroded over time. And so those socio-demographic factors that weren't an issue in the beginning may look very different now when they're under mortgage stress. So that's the perspective and learnings that I have seen in my time at the Leukemia Foundation and working in the blood cancer space for over 20 years. I'm going to move into the voice survey, which was prepared by clinicians and representatives of the patient associations. And the survey collected data from CLL patients, and we were striving to understand their awareness of the different risk groups within CLL, the impact that COVID-19 had or could have on CLL people, their knowledge of treatment side effects, and what would be the motivators and reasons for treatment discontinuation. The voice survey survey patients, as I mentioned, around their reviews regarding treatments and side effects. It was distributed between March and December 2022 to CLL patients from Europe, Latin America, USA, Australia, Egypt, and Turkey who had received one and more than one line of treatment. It was anonymous and available via an online platform, PDF form or hard copy. We utilised the patient organisations that supported this survey work in their reach to people who were interacting with their service as survey participants. So as you can see, good representation across the geographical space, or as mentioned earlier, within Europe, North and South America, Australia. There's obviously room for improvement when we look at more of the Asian and African countries, but we did demonstrate sort of consistency of themes coming through to validate sort of our findings. The voice survey, we've had successful abstracts and publications at ASH in 2022, EHA and ASCO in 2023, and publications in the Journal of Clinical Oncology, and as Sarah mentioned earlier, in Blood Advances. So we'll go through and share a few of the high-level moments that we saw in our results. And the first is around the heterogeneity of CLL. As you can see, almost 2/3 of people were unsure or unaware of the existence of different risk groups. And when we contrast that down, 70% of people indicated that they felt that all people should be tested to identify high-risk patients. And then on the contrast side of things, 50% of people were unsure whether they were a high-risk patient. So definitely a lot of confusion and lack of awareness around the existence of the lab test and also their own understanding of where they sat within that risk level space. The role of patients in CLL treatment management, and I guess importantly as well, the views and expectations of their physicians. Concerningly, 41% of people felt like they did not have enough information about their CLL to make informed decisions. On the flip side, 42% felt like they had more than enough, 48%, and then 12% had enough and more than enough information to make those decisions. Very much correlates to lots of conversations that I've had with people with CLL, that 90% of people relied on their physicians to answer their questions about CLL and treatments, that's their first port of call when it came to having an further understanding or have their questions answered. 3/4 of respondents wanted to be involved in their treatments decisions, but what this looked like in practice was only 44% who actually were involved in their treatment decisions. Impacts of COVID-19 on CLL treatment. When this survey was conducted, CLL was very prevalent in society, and for our people with CLL, it is still a concern for them, reported to me often. I guess where my concern is in the learnings of this slide is, that there was around 19% of people, or 1 in 5, who were unaware around their increased vulnerability to any type of infections. My lived experience of working with CLL people was not surprised to see that over half of respondents reported that COVID-19 had a moderate to high impact on their lives. And concerns around awareness around passive immunization as well, with only 54% patients being unaware of that and the impact that could have on them. Further around sort of working with their physicians and understanding, seeking further information about their treatments when it came to side effects. It's good to see that 81% of patients discussed their side effects with their physicians, and when they were seeking information, they did go via the internet with 42%, which I think can speak to the opportunity. We know that, gone are the days of telling people not to Google. That is an element of practice. So informing people, how I like to say, is to smart Google. What are the things that they should be looking for if they are seeking that information? We know through this that 42% of people are going to be doing that. And that doesn't mean that they're not seeking the information from their physician. They're probably consolidating that information online or seeking that further element when we look at that unmet needs or that complexity of need, to search for that little bit more of information to support their understanding of what's going on for them, and I guess taking on also the potential of their own advocacy and managing their side effects. So when we look at the impact of side effects and patients' reactions to this, as you can see, there's moderate to high impact in those domains of physical and psychological spaces. That was sort of the highest areas that we saw the highest impacts. And interestingly, no impact sort of reported in areas of social and emotional spaces in this survey, which is in contrast to the work that's been done in Australia, which showed probably alignment with the social space, but in the emotional space, sort of that distressed area being there. I guess what's really reassuring in this space is that we can see when it comes to responding to side effects that the really strong majority would consult their physician in any decision to continue or discontinue treatment as a result of the impact of those side effects. When we look at the fact that those physiological aspects of their side effects were really listed as moderate to quite high. There's an element of trade-off in that space. As you can see there, the listing of the hypertension, cardiac arrhythmia, skin infections, and generalized infections of being continuing on in that space. I'll talk a little bit later as a part of, as we went through understanding some of these findings. I know for some of my colleagues in this space, the skin cancer and the consideration of stopping treatment as a result of skin cancer was a surprise, but as a clinician in Australia, the skin cancer prevalence as a general population, but importantly in our CLL patient cohort can be very impacting for them. I guess, as I've mentioned earlier, one of the most reassuring things for us to understand in the side effects impacts and side effects influence on their decision to continue with treatment. Majority of patients declared that they would consult with their physician first if side effects occurred. More than 10% would continue their treatment as per prescribed if it was impacting things like their blood pressure, arrhythmias, or cardiac problems. 11% would continue treatments within infections. And 23%, concerningly, would consider stopping treatment without medical advice if they developed skin cancer. Hopefully, though, I know within Australia, the model of support in that space of side effect management calls upon a shared care model between the hematologist and dermatologist to support people. So this has really been a highlight reel of the findings within the Voice survey. There are those publications that enable further reading of greater insights that have been found, but conclusions of what we've discussed today, CLL patients do continue to rely on their physicians for information about their disease and its management. There was the argument put forward, possibly due to advanced age and diminished access for this population, though we are seeing that change and we are seeing behaviours of people seeking, as aforementioned, the 42% that looked for information online. There was a lack of awareness about risk groups and their treatment implications, which identifies an opportunity to improve the education in this space. Though we didn't speak specifically about oral treatments tonight, there were preferences for oral treatments in this survey and a high preference for people to participate in their treatment decisions and an opportunity to engage our CLL patients more to address that unmet need. That there is education about the risks of side effects, as it was identified that there would be people that would stop or continue treatment without consulting their physician, while it was enlightening to see that there was, around that 70% that definitely would guess, understanding those moments and reporting, and the importance of, I guess, side effects being as overcoming those, I guess, potentially bias or associations that may be attributed with reporting side effects. In the medical world, we use the word complaint, the patient complained of, as opposed to sort of, I guess, the language of reporting. So making sure that it's seen as a proactive moment, and something, if embedding that reality of having the participation in the treatment decision, really empowering patients to also report those side effects. As I mentioned earlier, most patients were unaware that CLL increased their vulnerability to infections. Again, that opportunity to improve patient understanding in that space. Generally speaking, this real world lived experience moments and reporting of CLL patients are that they are satisfied with the information they receive from clinicians, but I've identified a few gaps that we can target with better patient education that can improve patients to be more empowered with that information to come forward and have those really important conversations with their treating teams, or change those behaviours, or seek those things that they can do to minimize those impacts of side effects within their own self-management. So I guess, how does this compare the voice survey with the Australian experience? As I mentioned earlier, it came as no surprise to me that the physicians are the primary point of contact to answer questions about CLL and its treatment. At the Leukemia Foundation, we do develop a lot of content and support to help navigate what is CLL, what are those side effects, how can I manage the side effects? But there is a trusted, established relationship with a physician, and so we'll still remain a primary point of contact for people. That we do know a lot of people are seeking information about treatment benefits and side effects primarily via the internet. Majority of our referrals for service come via online inquiries nowadays, more so than phone calls. We also see a huge amount of engagement with our clinical content, as well as our supportive care content on our website. So there's definitely a thirst out there for people to seek that information. And as I mentioned earlier, the cessation or the motivation to end or discontinue their treatment due to skin cancers, it's something that I have witnessed over my career. People really being plagued with skin cancer, and unfortunately, it is about pre-exposure before their diagnosis. And I have memories of someone who spent all their youth volunteering on the beach to keep people safe in the waters, and as a result of that, was having lots and lots of skin cancer removal surgery a couple of years after their diagnosis of CLL. So now I am going to hand over to Anna, who's going to share more around the next steps from the insights of the voice survey.
Thank you very, very much, Catherine, and thank you very much for this really nice talk. Yes, as Catherine mentioned, we just wanted to take this opportunity to introduce the audience to this initiative that it's ongoing right now, which we call the Voice Portal for Patient Associations, that is very related to everything that we've been talking about, related to the voice survey results. So basically, this initiative, it's an online educational portal that it's intended for patient associations, with the main objective to improve the CLL knowledge among patients worldwide. And it is going to be based on the results of the voice survey that Catherine has just described. So basically, all of these knowledge gaps that were identified with the voice survey, the idea is to develop some learning objectives that are going to be tailored specifically to cover those knowledge gaps. So the idea is with the voice portal that the patients will be able to learn how to communicate effectively with their physicians and how to improve the communications about their disease and its management. We also intend with the voice portal that patients will understand how to manage COVID-19 and how to manage the impact of COVID-19 as well. Other of the objectives of the portal is that patients will learn about risk groups and treatment implications to make better decisions while interacting with their physicians. And also the final objective of the portal will be that the patients will be able to improve their educations and knowledge related to their safety and treatment. In order to achieve these learning objectives, we will develop some educational materials. There are going to be a total amount of 10 modules available in 9 languages, and these modules are going to be divided according to the learning objectives. So we will have 2 modules that are going to be focused on improving the patient's awareness on different risk groups. We will have 4 modules that are going to be tailored to raising the patient's knowledge on side effects of the treatment. 2 modules will be focused on understanding the impact of COVID-19 in CLL patients. And the last 2 modules will be focused on educating on potential risk behind treatment discontinuations. And all of these will be accompanied by 10 videos that are going to be featuring top key opinion leaders on CLL in order to transmit all of this information to the patient associations. These educational materials are going to be developed via a steering committee. We already have the chairs of the steering committee confirmed. 2 of the members of the chairs of the steering committee are going to be Professor Farouk Avan and Professor Lydia Scarfo, who actually have already collaborated in this series of educational webinars, the CLL Care program. And we are also counting with Professor Konstantin Tam. The plan is to have a series of top-level hematologists as well, collaborating in developing these materials from all over the world, from Europe, from Latin America, from the USA, etc. And also we count with representative of patient association, also distributed from all over the world. So we will be having representative from patient associations from different countries of Europe, from Egypt, from Argentina, or from Brazil, and of course from Australia. The idea is that this voice portal is going to be reaching a total amount of 127 patient associations. They will be granted access to this portal. These patient associations as well are going to be distributed internationally. We are going to be counting with patient associations from Europe, from Latin America, from Asia and the Middle East, from US, and also from Australia. And the main point is that then these patient associations are going to be able to transmit this information. We are hoping to more than 90,000 CLL patients worldwide. So we really expect and hope that with this educational portal, with the voice portal, we will be able to really have an impact in the CLL patient's life and correctly and properly address all these knowledge gaps that were recognized thanks to the voice survey results.